Hello friends, this is Dr. Sunil Tumala. I am a practicing neurologist and a yoga instructor. Today my goal is to help you understand what is blood pressure, why it is important to measure and what are its implications and how to measure it correctly. Often I see patients in the clinic who measure it incorrectly, either giving a false sense that it is normal or it is very high, and they get anxious in either way. So it is very important that we understand how to measure it correctly and what number is considered abnormal and why it is important to measure and what is it. Okay, so that's our topic for today's discussion. And again, this is Dr. Sunil Tumala. This video is purely for educational purposes, and I'm not providing any individual medical opinion here. It is purely for educational purposes. So let's get started. So the goal today is to measure blood pressure. And how is it measured? Why is it measured? And what are its implications? As you can see on the screen here, this blood pressure is a reflection of the pressure in your circulation. You need this pressure for this blood to circulate all over this body. Your heart is the pump. It is pumping this blood. And when it pumps the blood, it has to go around in the arteries, capillaries, and come back through veins back to the heart. So it is carrying this oxygen, glucose, nutrients to the tissues and bringing back the waste to the kidneys and lungs for it to excrete. So it is circulating, and the pump here is the heart, and the blood vessels are these pipes. The blood pressure becomes very important, especially for the brain and kidneys. Of course, it's important for every tissue, but for the brain especially, it's very important because the brain sits above the heart, and because of which there is an effect of gravity. If you drop the blood pressure too much, patients can feel dizzy, and it can have negative consequences. And if you don't control the pressure and let it run high, it can put strain on your kidneys, the filtering organs, and it can put strain on your pump, the heart, and make them weaker and not last longer. So it is very important that we not let it go too high. At the same time, we do not drop it too low, as it can have devastating consequences. Okay, so now let us understand what is this normal range and how do we measure it correctly. There are multiple ways you can measure blood pressure. The simplistic way at home is a non-invasive way. You can measure it invasively also. You can put a catheter with a probe, a pressure probe, pressure sensor into your circulation, into your blood vessel, into your heart chamber, and measure the pressure. That's invasive, not practical, especially in an everyday setting. So we use a non-invasive way, which is what is depicted here. So we are trying to inflate a cuff that has a rubber inside, a tube, a rubber tube inside. It has a bladder, and we inflate that so that we collapse the blood vessel, as we see here. So we are collapsing this blood vessel with the pressure of the cuff. And when the blood vessel is collapsed, there is no flow. We put a stethoscope just downstream, like what is shown here. So we are putting this stethoscope just downstream. And then we measure the pressure as the pressure in the bladder of this cuff is slowly reduced. As the pressure in the blood vessel exceeds the occlusive pressure exerted by this rubberized cuff, the blood starts to trickle down. Initially, you hear that tapping sound if you put a stethoscope downstream and listen. We are typically measuring it in your elbow, brachial artery. That tapping sound, the pressure at which that sound is heard, is referred to as a systolic blood pressure. And as you keep deflating the cuff, the blood vessel gets less and less occluded, and the blood starts to flow smoothly. And that point where the sound completely stops, you can't hear it anymore through your stethoscope, establishing a laminar smooth flow, is called diastolic blood pressure. Okay, so a systolic blood pressure is when you hear the sound. A diastolic blood pressure is when you stop hearing the sound, and this is after you inflate it fully, occlude the blood vessel, and starts to gradually deflate the blood vessel. In technical terms, systolic blood pressure is that highest blood pressure exerted by the blood on the blood walls. So the more the pressure, systolic pressure, the more pressure is exerted on the blood walls, and these blood vessels become sclerosed, scarred up. They develop plaques deposited with calcium and cholesterol, and these then lead to blockages in various vascular beds in your heart, in your kidneys, in your intestines, in your extremities, in your brain, where it can lead to strokes, heart attacks, kidney problems, kidney failure, hypertension, mesenteric ischemia in the gut, peripheral vascular disease in your peripheral vasculature, and you can develop complications in the eye as well. And that's a systolic. And the diastolic blood pressure is the pressure exerted by the blood during the relaxation phase of the heart. And this is also important, so don't neglect diastolic. We use another term generally. It is called mean arterial pressure. It is an average pressure. It is not exactly average of systolic and diastolic. It is, since the blood vessel spends most of the time in the relaxation phase of the heart, so the diastolic blood pressure has a higher weightage. Generally, we calculate the mean arterial pressure as a difference between systolic and diastolic blood pressure, and take 1/4 of it and add it to the diastolic blood pressure. But again, for practical purposes, for outpatient purposes, for general purposes, just leave it alone. Okay, so we are only going to focus on systolic and diastolic measured non-invasively. Okay, and so you understood why a blood pressure is needed and what it means. And now we will understand how do we measure it correctly. This I'm taking it from CDC, Center for Disease Control. The ideal way to measure blood pressure, there are many incorrect ways and there are some correct ways. In my opinion, this is the best way. You sit upright in a chair with your arm relaxed on a table. It's very important your arm is stretched and relaxed. If you bend it too much, there will be a lot of resistance. And if you don't relax it and if you hold it, there will be a lot of tension. So this arm should be relaxed and as straight as possible. And you put the cuff at the 1 to 2 inches above the elbow. Okay, so it's not at the elbow, 1 to 2 inches above the elbow. So that's where you put the cuff. And make sure the point, generally there will be a line on the blood pressure cuffs, and this line where the sensor is located is directly above the blood vessel. The blood vessel we are measuring is brachial artery, which is almost in the midline on the front of your elbow. So put that line marker around the middle point at the few inches above the elbow, and make sure that bulb, the bladder of that catheter covers at least 2/3 of your circumference of your arm. If you have a wider, bigger arm, you need a bigger cuff. Otherwise, it leads to incorrect measurements. So the key here is the bladder of the cuff. Generally, they put a line inside that blood pressure cuff. There is a small line where the sensor is located. There is a bigger line where there is a rubberized cuff. You want that bigger line, the length of your rubberized cuff to be covering at least 2/3 of the circumference of your arm. Okay, so put it around 1 to 2 inches above the elbow and keep your elbow straight. And you sit comfortably, relaxed, with the foot on the ground, and ideally you should not have eaten or drank any caffeinated beverages at least half an hour prior to measuring blood pressure. And you should have rested comfortably the day before. If you're stressed out, blood pressure obviously comes out high. So do not eat at least or drink any caffeinated beverages at least 30 minutes prior to your measurement. Drinking water is okay. And sit comfortably. Make sure you're not under any stress. So please empty your bladder, otherwise you feel stressed. And put your feet on the ground flat, and make sure you do not talk, because that can create some anxiety. That's the intent. So do not create any anxiety. It should be a relaxed environment. You can also measure it laying down, completely laid down, hand by your side. That probably is the perfect way. If you can't do it, sitting is the next best way. Generally, the blood pressure drops as you go from laying down to sitting and then to standing position. So sitting blood pressure is in between your laying down, which is generally the highest, and standing, which is generally the lowest for you. And generally the right arm blood pressure is around 5 millimeters of mercury above your left arm blood pressure, which is very common. If it is more than that difference, then we need to look into what might be the cause. So measure it, right arm stretched, relaxed on the table, you are sitting comfortably, relaxed, and not under any stress. Okay, and once you take that position, I would say wait maybe around give of minutes or maybe 5 minutes in that position, then start measuring. You take first measurement and give 1 minute break and take one more measurement. If these two measurements differ by more than 5 millimeters of mercury, either in systolic or diastolic, I would say you need to take the third measurement. And if they differ very widely, there must be some error in your technique of measurement, or there must be problem with your blood pressure monitor. If the measurement technique is correct, and if your device is working good, there should be consistency and reproducibility in the results taken with 1 minute interval. Okay, make a note of these blood pressure measurements. Measure 2, take the highest you get, but those two should not differ by more than 5 millimeter mercury pressure. If they differ by more than that, make sure you talk to your doctor or talk to your pharmacist or get a new blood pressure monitor and measure it correctly. Okay, and so now that's a automatic way of measuring it. That's an automatic blood pressure monitor. For most of the folks, I would recommend just get a fully automatic. It inflates automatically, it deflates automatically, so that you are not sitting there pumping. That pumping itself can raise your blood pressure. So I would recommend a fully automatic blood pressure monitor. And now the question is, what is normal and what is high? What is normal and what is high depends on the age. I'm going to use a Joint National Committee 8 guidelines. So this is called JNC 8 guidelines. So there is a AHA guidelines as well, but just stick with this for simplicity's sake. Here the guidelines say, if you do not have any heart disease or kidney disease or diabetes, then your blood pressure targets are determined by the age. As we age, our blood vessels become stiffer and our blood pressure requirement goes up. Okay? So if you're less than 60 years of age, the recommendation is keep your systolic below 140 millimeters of mercury and keep diastolic below 90. If you're 60 or more, then keep it below 150 systolic and keep it below 90 diastolic. Any blood pressure more than those targets is considered as hypertension. There are gradations in hypertension. We are not going to go there now. However, if you have any kidney disease or diabetes or heart disease, the targets are different. The generally accepted target for these folks, irrespective of the age, is less than 140 systolic, less than 90 diastolic. Again, these measurements are generally acceptable for folks 18 years of age or more. For children, the blood pressure targets are different, and I would recommend you talk to the pediatrician for that. This is the guideline generally for adult population. So here we discussed about what is blood pressure, how do you measure it correctly, and what are the targets. I'm not going to bore you into what happens if blood pressure is high and all those things. You probably know about it. It's bad for health. But if your blood pressure is high and if you want to treat it, the single most important thing you can do is dropping the body weight. If you are overweight or obese, just dropping that body weight will dramatically improve your blood pressure control. You probably do not need a pills. And what is the best way to drop the body weight? Control your calories. Control your calories. There is no shortcut. If you think that there are some pills to drop the body weight, none. There may be some. I would not personally recommend. Control your calories, do exercise. And if they fail, certainly think about medications, surgeries, and all those things. But the most important thing to drop the body weight is making sure you control your intake of calories and increase your output of calories through gentle exercise, which is good for heart health as well. And keep yourself calm. Mind has tremendous control over your body, including the blood pressure. If you're stressed out mostly and you're anxious, obviously you have sympathetic drive and your blood pressure is going to be high. So keeping yourself relaxed will go a long way in optimizing the control of your blood pressure. So the two most important things to control blood pressure: relax and keep your body weight optimal. And what is the best way to keep body weight optimal? Eat less and exercise. Okay, so hope this helped you. And if you have any questions, please leave your comments. Please leave your questions in the comment section. I will guide you to the right direction to the best of my ability. I may not answer everyone's question, so I would recommend you explore the Center for Disease Control website as well. But I will do my best to answer if I can. Thank you and Dhanyavad.